Greetings, my name is Stephen Willis and I'm a doctoral student here at Spalding University. The presentation briefs today will be Unified Theory Project. The presentation time will be between 10 to 20 minutes and the writing style will be APA 7 format, and that's where applicable. So let's get into it, shall we? So the Unified Theory Project domain proposal consists of the primary field, population health, the topic, how is health equity being advanced or not advanced in Louisville, Kentucky, the domain, social determinants of health, root causes, and the primary literature being used is the 2017 Louisville Metro Health Equity Report. And finally, the correlated fields is history, health, and healthcare. So it's pretty broad. So let's move on, shall we? So the problem statement is Louisville faces social determinants of population health. And I'd like to take your attention down to access to healthcare services is critical for the Louisville community. So a comprehensive investigation into healthcare accessibility is needed to devise resilient solutions. Analyzing population-affected disparities will help develop effective strategies, hence the intervention plan, to address the healthcare affordability/accessibility crisis. The main focus of the problem is to increase healthcare accessibility for the citizens of Louisville, and especially the underserved community. So what's the justification of this study? Well, population health research is an important domain that aims to understand and improve the health of the communities. In the case of Louisville, it is crucial to explore the justification population health research and how it contributes to, and this is what I underline, advancing health equity in the region through improved healthcare access. So specifically, it is essential to examine how social determinants of health, which are root causes of health disparities, are being addressed or not addressed in Louisville. By achieving these factors, we can better understand the current state of health equity in the region and identify opportunities for improvement that will lead into an effective intervention plan. So the next 4 slides will be the literature review. So let's start off with Louisville's population health. Hassenbuehler discovered stigma related to population health is negative attitudes towards a group of people due to their health status. It causes discrimination and adversely impacts health outcomes. So things you see in red is sort of my feedback, and you'll see they're either in red and green, and I'll explain green later. But my feedback is addressing this stigma is crucial for population health to ensure equal health care access is respectful treatment for all people. Population health care. So Van Heiden discovered that 1/3 of patients hospitalized in the community acquired pneumonia in Louisville provided incorrect self-reporting pneumonia vaccination history. So things in green will be part of the intervention plan and why I came up with the intervention plan that I did. So maybe this will help explain, but things that were related to the intervention plan, that's why I came up with what I came up with. Carrio's research found that 700 adults hospitalized with COVID-19 between March and July 2020, 23 were healthcare workers. The majority of them had underlying health conditions and suffered from severe complications. So the research highlights the significant impact that COVID-19 had on population health in Louisville, not only the citizens, but also the healthcare workers. All right, so population health history. And I'm really excited about this research right here in particular, and I have a gold star by the second Fairchild research because it let me find out actually a root cause of social determinants of health. But I'll get to that in a little bit. So Cutler and Miller found the clean water technology significantly reduced U.S. mortality rates by half in major cities during the late 19th and early 20th centuries. So my feedback is access to technological advancement played a crucial role in improving the population's mortality rates and overall health outcomes in cities like Louisville. So that's a major key in my intervention plan. So Fairchild found that the American public health profession has suffered from social reform to scientific methodology health care practices. So I found that we must support this shift. We must identify allies and overcome hindrances from radical reform. So, I'm not going to go too deep into this, but Fairchild was the most exciting breakthrough of this research. I helped identify, it helped identify a major root cause of social determinants of health, and I'm excited to share that with you in just a little bit. So general health population health for general health. So Shutt conducted research in Louisville to decrease cardiovascular disease risk factors in underprivileged communities. Patient retention rates were low due to lack of comprehensive policy adjustments. And my feedback was policy makers should implement policy changes to promote a more equitable and inclusive environment. So they should be centered around the underprivileged communities. So I really think that that's a pain point, and policy just shouldn't be for everyone. Policy should be for everyone, but especially those centered around the underprivileged community. So Barrett, and moving on to my next case, Barrett found that the program called Air Louisville is a cross-sector partnership that positively addressed asthma by equipping patients with electronic inhaler sensors to monitor medication use. This led to a 78% reduction in the rescue inhaler use and a 48% improvement in the symptom-free days and symptoms-free days. So the crowdsourced data developed policy recommendation. So what I sort of gleaned from this is investments in technology increases Louisville's overall public health throughout the community. So moving on to the intervention plan. So the intervention plan, key elements. Louisville faces healthcare challenges due to limited availability of healthcare and healthcare education. This affects the well-being of residents, and it hinders the efforts to achieve health equity. Policymakers, healthcare providers, and educators need to work together to ensure quality healthcare and healthcare education for all Louisville residents. So the solutions approach. Meadows System Zoo framework can serve as a valuable resource for individuals to seek and understand the complexities inherent in addressing Louisville's population health problem statement. By exploring intricate interplay of systems and subsystems, this approach can facilitate a more comprehensive understanding and challenges at hand, and ultimately will lead to more effective solution. So the Delta desired stage is to improve healthcare outcomes for all Louisville residents. We need to innovate solutions like remote healthcare services and healthcare education programs, investments in technology for telemedicine and virtual consultations, and develop programs that address our community's unique needs. This will create a healthcare system accessible for all, regardless of location or socio-economic status. So moving on. So the action plan. Implementing telehealth kiosks in targeted areas of Louisville can significantly improve healthcare accessibility, minimize costs, and offer great flexibility. The kiosk will be equipped with state-of-the-art technology that facilitates virtual consultations with healthcare professionals and strategically placed in public service facilities such as healthcare centers and libraries, many more, but moving on. Patients can easily access healthcare services at their convenience, and the initiative will contribute to the community's overall health. This would be achieved through joint activity bonding, as a proximity of the healthcare physical location is crucial in creating a great psychosocial system. The goal is to create a shared understanding and values, and leading to intersubjectivity, which will positively impact the health of Louisville residents. So the last part, means of influence. This aims to promote telehealth services in Louisville, educating people about the benefits, including convenience, efficiency, and affordability. The primary means of influence will be modeling, and I've underlined it because modeling is the primary means. Okay, and teaching people how to utilize telehealth services effectively, empowering them to make informed decisions about healthcare and improving the region's overall health outcomes. The initiative aims to reduce the need for in-person visits, minimizing exposure to contagious diseases while providing adequate medical care. The initiative will use the zone of proximal development to teach people about the benefits of kiosks and help them reach their higher level of competency mastery. Super excited about this last part, my critical insight and takeaway. So the social determinants of health root causes. So Fairchild addresses in the late 19th century and early 20th century the shift from social reform-oriented approach to a science-based approach. A social reform-oriented approach is a strategy that bring about positive sociological changes through the reforms and policy. This approach typically addresses social issues such as poverty, inequity, discrimination, and injustice that involves collaboration between individuals, organizations, and governments to create a sustainable health solutions. The ultimate goal to social reform-oriented approach is to improve the overall well-being and quality of life for individuals and communities. Now, medicine has moved towards a more science-based identity in modern times, as Fairchild suggests. The shift towards evidence-based medicine ensures that medical treatments and procedures are grounded in empirical evidence rather than anecdotal or traditional practices, as stated above. As a result, healthcare professionals have increasingly rely on the latest scientific research and data to inform decisions and treatment plans, resulting in better patient outcomes, as Fairchild also suggests. What does that have to do with population health concerning social determinants of root causes? And I say everything. Why? Because medicine moved away from population health, and the focus is on a science-based approach. Let me stress this again. Social reform approach addresses social issues such as poverty, inequality, discrimination, and injustice, and it involves the collaboration of individuals and governments to create a sustainable health solution. So the root cause is based on the science-based approach is the likely major root cause of social determinants in the health because it has shifted away from population health focus, and it hurts minorities, low income groups, and underserved communities more than anyone. And that's so powerful to find that out, that in history they shift from more of a population health focus to a more medicine-based focus, and that just means just everything as far as determining a root cause. So I'm very excited about that. So that's my last slide, and I want to thank you guys. It's been a really good experience, And God bless each and every one of you. Thank you.